Thank you for viewing the 2017 Employee Benefit Program for Higginbotham. Open enrollment will be held from November 7th through the 18th. First, I'd like to cover what's changing in 2017. Your medical plans are not changing. They'll still be with Blue Cross Blue Shield, and we still have our PPO and our health savings account. The change that you'll see is the employee premiums are actually going to be reduced if you're covering dependents. Blue Cross Blue Shield has a few things going on in their network. First of all, Kelsey-Seybold is no longer in the network, and they're in negotiations with THR, and there's a possibility that they could be exiting the network as well. So if you have providers in Kelsey-Seybold, you definitely need to look for new providers, and if you're using providers in THR, Texas Health Resources, you may want to look for other options. Compass can help you do that research. Blue Cross is also changing their drug formulary. The new name is going to be the Enhanced Drug List. What this means for you is there's going to be fewer brand name drugs on the preferred brand name drug list. Also, CVS and the CVS pharmacies within Target stores will not be in network. Blue Cross will be introducing preferred pharmacies that offer generics as low as zero copayment. And I just want to remind you that because of these changes, your drug costs may change. It may be going from one tier to another. If you need to research that after these lists are published, you can call Compass to do that. Once these lists are published, we will send out that information via email to everyone. If you have a health savings account, we are eliminating Tango. They will no longer be our administrator. HSA Bank will be our new partner, and all 2017 contributions, whether it's employer or employee contributions, will be made into HSA Bank accounts. If you'd like to keep your current HSA, you can do that, but you'll be responsible for their monthly fee, and it does not include Tango. If you want to roll over any current balance that you have in another HSA, you can do that once your bank account with HSA Bank is open. We have a new medical emergency transport benefit available through MASA as a voluntary plan option. Our dental will be changing carriers to MetLife, and we're increasing the calendar year maximum to $1,500. There are special orthodontia takeover provisions. Make sure you read about that in the enrollment materials. If you're enrolling in the DHMO, you must select a primary dentist in the enrollment system. If you're not electing the DHMO, please enter NA for the facility ID in the enrollment system. When you're enrolling, there will be page 5 in the enrollment system that will give you detailed instructions on how to locate your facility ID and your primary dentist. Medical flexible spending account limit is increasing to $2,600, and there's an enhancement to our long-term disability. Currently, all benefits when you need them are taxable. This enhancement will make the benefit non-taxable, giving you more bring-home pay if you go out on disability. And all you have to do is pay the tax on the employer-paid premium. Our worksite plans are changing this year. The legal is changing to Texas Legal. Accident plan will be administered through American Public Life, and our cancer, heart attack, and stroke plan will also be through American Public Life. Only these worksite plans will be offered through payroll deduction. If you have any other worksite plans currently, you can certainly keep those. You just need to make arrangements to pay the carrier directly. Now that we've covered what is changing, let's talk a moment about what's not changing. Our Wellness Within program is still going to be in full force. The program requirements are changing just a little bit, and those will be posted to our wellness portal. Higginbotham will continue to offer a PPO and a health savings account through Blue Cross Blue Shield of Texas. Telemedicine will continue through Teladoc, and remember, this is no cost to you when you use the service. Compass will continue to help all of our employees save on the cost of our medical care and act as our advocate with claim issues. Higginbotham will continue the current contributions to your health savings accounts. will continue vision through Davis Vision. Our voluntary life and life plans will be through Dearborn. Unum will still continue administering our long-term care. Higginbotham, of course, will continue to administer our flexible spending account and dependent care account. Our 401k will continue with Principal, and our personal home and auto through Travelers Benefits Plus will remain in place. And our Employee Assistance Program is still through Disability Resource Services. Open enrollment is November 7th through the 18th. Every employee needs to log into MyPay and make your elections between November 7th and 18th. You will either elect to continue your current benefit plans, elect your 2017 Community Fund and 401k contributions, change any of your plan elections, change any of your covered dependents, elect your 2017 contributions to the flexible spending accounts for medical and or dependent care, elect your 2017 HSA contribution, or elect any of the new worksite plans. Remember, guaranteed coverage will only be available during this open enrollment period or during your initial eligibility. If you do not log in to make your elections, you will only receive the default benefits for 2017. Those would be basic life and AD&D, long-term disability, and basic long-term care. If you have any questions during this enrollment period, please contact the Higginbotham helpline. You can email them at helpline@higginbotham.net or call them at 817-347-7093 or extension 7093 from the office. Once you complete your enrollment, those enrollments will go into effect on January 1st, and they will remain in effect until December 31st of next year. Keep in mind that you're not able to make any changes to your elections until open enrollment next year unless you experience a qualified life event. So if you have any of the events listed here and you need to make changes to your benefits, you have to make those changes within 31 days of the event, or you lose the opportunity until open enrollment next year. You are eligible for benefits if you're an active employee working 30 or more hours per week. You may enroll your eligible children in benefit plans up to the age of 26. If you're signing up for the Medical Flexible Spending Account for the first time, you need to register with www.mywealthcareonline.com/Higginbotham in order to have access to your balances. One debit card will be sent to you automatically, but if you need additional cards, you should email flexclaims@higginbotham.net. You will only receive a new medical card if you make plan changes or add or drop dependents. You have two medical plans from which to choose. One is a preferred provider organization plan, and the other is a health savings account. Let's talk first about how both plans are the same. They will both be administered by Blue Cross Blue Shield of Texas, and they both use the same network of providers, which is the Blue Choice Network. They both have in and out of network benefits available. I'll be covering the in-network benefits only. Please know that if you go out of network, you'll be paying more out of your pocket. The reason is twofold. First, your benefit levels are lower out of network, and secondly, your in-network providers have agreed to charge Blue Cross Blue Shield a negotiated rate, and we call that an eligible charge. When you go out of network, those providers have not agreed to an eligible charge. However, that's what your reimbursement will be based on. So you will be responsible for not only the cost of your out-of-network care, but you'll be responsible for the difference in what the non-network provider charges and what that eligible charge is, which in most instances is very significant. Both plans cover preventive care at 100%, and don't forget on both plans you'll still have your teledoc telemedicine, which is covered at 100% at time of use. So let's talk about how they're different. The PPO plan first. When you go in network, you have a copayment when you go to the doctor. If you're seeing a primary care type doctor, which would be a family doctor, an internist, that is only $30 per visit. When you're seeing a specialist, it's $60. And when you go to urgent care, you'll pay $35. But anything else other than those items that I've listed, you will have to pay 100% of the eligible charge until you meet your annual deductible. Your deductible on this plan is $3,000, and your family deductible is $6,000. Once you meet your deductibles, then you only have to pay 20% of the remaining charges until you meet your out-of-pocket maximum. And on the PPO plan, the medical out-of-pocket maximum is $5,500 for an individual or $11,000 for a family. Keep in mind, if you go to the emergency room, that is your most expensive place to get care. So you'll be paying a $250 copayment plus 20% of the charges. In any of your physician charges, you'll pay 100% of that eligible charge until you meet your deductible, and then after that it'll be 20%. Your health savings account option is very different, but it's simple. On the health savings account plan, you pay 100% of the eligible charge until you meet your $4,500 individual deductible or $9,000 family deductible. Once that's been met, then you have no other fees that you have to pay in network for the rest of the year. And this includes your prescriptions, where the PPO does not. As I said earlier, the preferred drug list is going to be changing, and the new name will be the enhanced drug list. The biggest difference in this list is there's going to be fewer drugs on that preferred brand tier. So many of you may have your drug cost increasing because it may be changing tiers this year. Also keep in mind CVS and all the CVS's within Target will no longer be in the network as of January 1st. We do have dispenses written requirement, and that means that if members request a brand name drug when a generic is available, you will not only pay the brand name copay, you're also going to pay the difference in the cost of the brand name and the generic medication. So, if at all possible, request generics when available. If your physician proves to Blue Cross Blue Shield that it's medically necessary for you to take the brand name drug, then the penalty won't be applied. Your generic copayment is $20, your preferred brand name copayment is $40, and your non-preferred name brand copayment is $60. You can use mail order for convenience. You'll ask your doctor for a prescription that says you need 90-day supply, and you can send that in to the mail order vendor, and that can be sent to you to your home so that you don't have to go to the pharmacy every month. The separate out-of-pocket maximum for prescriptions is $1,000 for an individual and $3,000 for the family. And again, on the health savings account, you pay 100% of your eligible charges until you meet your deductible, which is also your out-of-pocket maximum. Employees enrolled in the health savings account plan can also open their own health savings account. In order to have a health savings account, the IRS requires that you're enrolled in a qualified HSA medical plan. You cannot be claimed as a dependent on another person's tax return, and you can't have any other health coverage either through your spouse's medical or pharmacy plan. You also can't be covered through Medicare Part A or Part B, and you cannot be covered through a general purpose flexible spending account, either yours or your spouse's. You can, however, have a limited purpose flexible spending account for dental and vision expenses only. There's lots of benefits to having that health savings account. First of all, you can make tax-free contributions. The accumulation belongs to you, and it's tax-free growth. There is no use it or lose it rules. The money is yours, and as long as you spend it for qualified expenses, you're never taxed on what you put in. You're never taxed on the accumulation. The eligible expenses are defined in IRS Publication 502, and they're the same eligible expenses that you'll see under a flexible spending account. Higginbotham will continue to contribute $46 a month into your HSA for you. The maximum this year has been increased. It's $3,400 for an individual and $6,750 for a family, and this includes the $46 per month, so you can only contribute the difference. There is a catch-up provision. If you're age 55 and older, you can contribute an additional $1,000. And those contributions can be made anytime during the year that the participant turns 55. Higginbotham completed an extensive benchmark study this year. It's important that we know how we compare to our competitors, to other employers our size, to other employers that are fully insured as well as self-funded. The results of that study was that we had some opportunity, and Higginbotham has decided to decrease dependent premiums this year. Our base plan is going to be our health savings account plan. And if you're on that plan, you will just see reductions in your dependent premiums. If you are on the buy-up plan, you will see a small increase if you're employee only, but you will see a decrease if you're covering your dependents. Which plan is best for me? Anna Allen in our Dallas office was kind enough to put together a slide showing us a comparison of your expenses on the high deductible health plan with an HSA compared to the PPO. We're going to look at a best case scenario, meaning you really don't have any medical care and you're just paying your premiums. And we're also going to look at a worst case scenario. And under worst case scenario, you would have to meet your entire deductible, co-insurance, out of pocket, and pay for all of your services. We have split this up into 4 different analysis. First, if you're only covering yourself, so that would be the employee only section. Secondly, if you're covering you and your spouse. Third, if you're covering just you and children. And then fourth, if you're covering you, your spouse, and your children. So let's look at employee only under the first or the middle column, the high deductible health plan with HSA. In the best case scenario, you know you'll pay your premium, which is $563. You don't meet any of your deductible, no co-insurance, no co-pays. Higginbotham will contribute $552 into your health savings account, and you don't qualify for a health reimbursement under the plan because you did not meet your deductible. So in this scenario, you pay $563 for the plan. Higginbotham gives you $552, so you really only end up paying $11 for your medical plan. Worst case scenario, you still pay the same premium, $563. You have to meet your entire deductible, which is also your out-of-pocket, so that's $4,500. But remember, Higginbotham will give you $552, and they'll actually reimburse you $1,000 of your deductible, and that $1,000 is always the last portion of your deductible. Once you get that reimbursement, the net cost to be on the high deductible health plan in the worst case scenario is $3,511. Let's compare that to the cost of being on the PPO. First of all, your premiums are more than double. It's $1,187 just to be on the PPO, and that's regardless if you use the plan or not. In the best case scenario, you don't use the plan, you do not get a HSA contribution because you're not eligible, and you haven't used your deductible, so you don't get an HRA. So under the best case scenario, you still pay $1,187. If you compare that to the health savings account and high deductible health plan, you've actually paid $1,176 more than you need to just to be on the PPO plan to have a copay for office visits and things. Now let's look at the worst case scenario. You still have the premium, which is $1,187, but you've met your deductible. It's $3,000. In fact, you've paid co-insurance, all of those things up to $6,500. You're still not eligible for the HSA contribution, but you are eligible for that last portion of your deductible to be reimbursed, and that's $1,000. So your net cost to be on the PPO plan, if you're employee only, in the worst case, is $6,687 for the year. Compare that to the $3,511 on the health savings account. So in a worst case scenario, you've overpaid $3,176 just to be on that PPO plan. When you look at the employee spouse, Anna did the same comparison. So bottom line, if you enroll in the PPO, you're overpaying $3,449. And if you're in the worst case scenario, you're overpaying $8,149. If you look at employee, child, and children, you're overpaying $2,848 under the best case scenario and $7,548 under the worst case. And on the family, you're overpaying $4,100 under best case and overpaying $8,800 for worst case. Now this is assuming that you're non-tobacco and on the wellness rate. To look at this another way, if you're currently on the PPO, you are paying 100% of your premiums to Blue Cross, whether you use the plan or not. After you pay your premium, you still have all of your copays, deductible, and coinsurance up to the $5,500 medical maximum, $1,000 prescription maximum. You will get reimbursed that $1,000 from the health reimbursement account, leaving your total out-of-pocket at $5,500 for an individual and twice that if you're covering dependents. And you don't have a tax advantage account that you can put money in and save year over year over year. So let's think about this. What if you paid the equivalent of your PPO premiums so that you're not out any more money than you are today, and you enroll in the health savings account? Let's look at employee only. The health savings account premium is only $46.91. The PPO premium is $98.83. The difference of that is $51.92 that you could put in a health savings account rather than pay in premium. Higginbotham would then give you $46, so your total monthly contribution into the health savings account is $97.92, or $1,175 a year. That's in your savings account. That's money that you can now use for the cost of your care. Let's look at employee spouse. The PPO premium is $807. Your health savings account premium is $565. If you put that difference of $241 in your account, Higginbotham gave you $46, that would be $287 a month that you can now use for the cost of your care. Over the year, that totals up to $3,449 that you can use towards the cost of your care. And if you don't use it, it's in a savings account for you to use in the future. If you're just covering you and children, if you do the same thing, then you can use $2,847 for the cost of your care instead of just paying it in premium. And if you're covering your whole family, that's $4,099.80 that you can now use for the cost of your care. The high deductible and HSA out-of-pocket maximum is really only $3,500 because you have your $4,500, but Higginbotham will still reimburse you $1,000 for the last part of your deductible. If you're covering dependents, your out-of-pocket maximum is really $7,000 after you consider the HRA reimbursement. So the funds listed are money that you can pay towards your out-of-pocket expenses. So people then ask me, what's the downside? Because this looks great. Well, the downside is, if you have a health savings account, you can only use the funds that have been deposited into your account. So if you have a lot of prescriptions that you have to get in January and February and they're expensive, you're not going to have much money in your health savings account yet. So you may have to come out of pocket for those expenses. Also, if you go to the emergency room or the hospital and you have a great big bill, you're not going to have the money at the beginning of the year. Now, consider this. If you're on the PPO plan and you go to the emergency room, you're actually in the same position. You have to meet your deductible and coinsurance. So really, my biggest concern to moving to the health savings account would be those prescriptions. This is a great plan. If you have any questions whatsoever, feel free to call Barbie. My extension is 6953. You can call our helpline, or you can send emails to the helpline or bmcnutt@higginbotham.net. Teladoc is given to all employees, and there is no cost to you or your dependents to use the service. It's very simple. Log in and complete your medical history, and then request a medical consult. You'll talk with a U.S. board certified physician, and they'll resolve your issue. If you'd like them to, they can send notes to your primary care doctor in order to have continuity of care. And then reconciling your account is simple because you don't have to pay anything for this service. Teladoc is a valuable service for those urgent situations that aren't true emergencies. You can contact them any time of the day or night, 24 hours a day, 7 days a week, 365 days a year. Please remember you have this service. It's absolutely free to you and your dependents. You can use this service when your physician is unavailable, when they don't have any appointments maybe till the following week, or they don't have any after-hours appointments. Also remember about this service when you're traveling and you don't have time to go see your physician, or if you're too busy at work and you don't want to take 2 or 3 hours out of your work day. When you're on vacation or a business trip anywhere in the United States, you can call Teladoc and speak to a U.S. board certified physician. They can also refill recurring prescriptions on a short-term basis. And they can also take care of your children of any age. So if you have a child that wakes up in the middle of the night with 102 fever, call Teladoc. Talk to a U.S. board certified physician and find out what immediate measures you need to take care of your child. What better resource could you have than a physician on call? Certainly, if you have a life-threatening emergency, we want you to go to the nearest emergency room. But if you have non-emergency situations, we ask you to please not use the emergency room. Use convenient care clinics, urgent care clinics, or Teladoc. Teladoc can actually give you effective resolution to a wide range of conditions. The top diagnoses are listed here that people use telemedicine to help them resolve. Things like sinus problems, urinary tract infections, pink eye, bronchitis, upper respiratory infection, etc. All of these things are urgent and they need to be taken care of, but they don't really need to be taken care of in the emergency room. So remember you have this free benefit because not only can they diagnose your problem, but the doctors at Teladoc can call in prescriptions based on your diagnosis. They'll follow proper prescribing guidelines through the CDC. They will not give any controlled substances, psychiatric or lifestyle drugs. And they also have a 98% generic prescribing rate, which also helps us keep our medical costs down. It's extremely convenient, and they send your medications to your pharmacy through e-prescribing. I've actually used this service on many occasions, and normally I can have my consult with my doctor before I could even drive to my doctor's office. Another service that Higginbotham provides to you is through a company called Compass. Compass is an advocate service and a transparency service. They're there to help you understand your benefits, find a great doctor, save money on medical care, pay less for prescriptions, and get help with your medical bills. And they'll help medical bills for you, your family, or even your parents. We want all of our employees to be wise consumers, and we don't want anyone to be overcharged for medical procedures. And that's one of the reasons we have Compass. You know, it's a misnomer that if you use an in-network provider, that they all charge the same. All doctors and hospitals have different fees for the same medical services. In this example, an MRI of the knee at local facilities. At Hospital A, it's $3,300, Hospital B, $2,300, and a diagnostic imaging center down the street was only $450. That's 7 times the difference in the cost between Hospital A and that diagnostic imaging center. We're providing you with the tool to contact Compass to save you money and also to help Higginbotham's plan save money so that our premium increases do not continue to go as high year over year over year. So when you're going to have any kind of medical service, please call Compass first. Make sure you're not overcharged for medical procedures. Compass can also help you pay less for your prescriptions. Most medications have a generic equivalent, and if not, they normally will have a clinical alternative. You can call Compass and they can do a medication review with you and let you know if there's a generic equivalent or clinical alternatives and talk with you about the options that you have. I have two examples here. Crestor does not have a generic equivalent, but it does have clinical alternatives. And if that clinical alternative would work for you, you could save up to $136 a month. Effexor XR has a generic equivalent and clinical alternatives. You could save between $69 a month and $101 a month if one of these alternatives would work for you. If you're taking several medications, please contact Compass and see if there's a way they can help you save money. Compass will also work as your advocate. If you have medical bills that you don't understand, if you get explanation of benefits and bills from multiple people, and you don't know who to pay and how much you need to pay, contact Compass. They'll help you with your medical bills. They will give you unbiased advice and expert guidance. They understand your coverage, and they'll help resolve disputes with providers. They can help with appeals, and they'll actually coordinate refunds if refunds are due to you. I want to assure you that Compass will not share any of your personal information with Higginbotham. They will not provide medical advice, and they're not designed to replace your doctor. They're not here to provide assistance for medical emergencies. Again, if you have a life-threatening emergency, go straight to the nearest emergency room. And they are not receiving money for recommending one doctor or hospital over another. Compass really is here to help healthcare be simplified. Our coach is listed here. You can call them Monday through Friday, 8 to 6. Keep in mind, you can call them for all sorts of things as we've discussed. But if you've recently moved and you're looking for a new provider, if you have an upcoming medical procedure, if you're just tired for paying so much for your prescription drugs, or if you're even wondering if a medical bill is correct, please be sure to reach out to our Health Pro. Medical Air Services Association, known as MASA, will be providing medical transport solutions for us. You can elect to enroll in the Emergent plan or the Platinum plan. As most of us know, when you use an air ambulance or ground ambulance, those services are never covered in full through your medical plan because the transport services do not contract with the insurance companies. Therefore, most people are left with a large balance bill. What MASA does is they negotiate that bill as low as they can, and then they pay that balance bill for you. You'll see on the Emergent plan you would be covered for emergency air transport as well as ground transport. If you elect the Platinum plan, you would be covered for transport from hospital to hospital. If you have a minor child or grandchild with you, that would cover their return. Organ recipient transport, organ retrieval transport, repatriation worldwide, non-injury transport, pet return, vehicle return, return transportation, escort transportation, mortal remains, and worldwide coverage. If you'd like to elect this plan, you will just do that through your enrollment process. Texas Legal will be our new provider for our legal plan. Texas Legal is actually credentialed with TDI. They have two plans from which to choose. One is a preferred plan, and the preferred plan costs only $15 a month if you're single or $20 for your entire family. It has ID theft monitoring and restoration. It has your unlimited access for legal advice via telephone. It also covers estate planning at 100%. And it has coverage for family law, consumer, civil defense, and criminal defense. There's financial counseling available. You get 4 attorney consultations a year and 6 hours of general legal services included in your plan. The Select plan through Texas Legal is only $8 a month for a single person and $10 for the entire family. It also has identity theft monitoring and restoration. It covers estate planning 100%. It has limited coverage for family law and for defense. You get discounts on legal fees for criminal, consumer, and financial law. It includes 2 free hours for attorney consultations and 2 hours of general legal services. And of course, you have unlimited access to the Legal Access line for legal advice. Texas Legal partners with All Clear ID for their identity theft monitoring and protection. They prevent identity theft by monitoring your credit, giving you fast and secure phone alerts, monthly email statements, lost wallet protection, as well as child scan monitoring. They have $1 million identity theft insurance coverage. If they have to help you repair your identity, that support comes from All Clear investigators as well. Accident insurance will be provided by American Public Life going forward. This will be the only accident plan that will be payroll deducted. If you'd like to keep your current plan, you can do that, but you'll need to make arrangements directly with your current provider. Accident insurance is really just designed to help you offset expenses in the event that you or a loved one is injured in an accident. You'll have 2 plans to choose from, Plan 1 or 2. The emergency room benefit is the same on both plans. The ambulance, either ground or air, is also the same on both plans. The difference begins if you're hospitalized. The initial hospitalization benefit on Plan 1 is $500 and on Plan 2 $1,500. If you're confined in the hospital for more than that initial stay, then you are paid $100 a day on Plan 1 and $300 a day on Plan 2. If you are in intensive care, then Plan 1 pays $200 per day and 2 pays $600 per day. In addition to those benefits, you have specific sum injury benefits, and the amount that you get really depends on what you hurt or fracture or dislocate. Payments are made for things such as dislocations, ruptured discs, eye injuries, fractured, lacerations, concussions, etc. The benefits on Plan 1 range from $100 to $3,000, and on Plan 2 they range from $150 to $4,500. If you elect this plan and you or a covered family member have an accident, then your benefits will be calculated based on the services provided and the injury incurred, and the payment will be made directly to you. Rates are in your benefit guide as well as in the online enrollment system. American Public Life will be providing our cancer insurance with heart and stroke coverage. It's very important that everyone understands during open enrollment or during your initial eligibility if you're a new hire, you have guaranteed issue coverage, which means that you do not have to answer any medical questions to qualify. If you do not elect coverage during this open enrollment or during your initial eligibility period, then there's no guaranteed coverage. If you elect coverage, there is a pre-existing condition exclusion, and that means if you currently have one of these conditions, that condition will not be covered during the first year. But once you've been on the plan for 12 months, then you have full coverage. This plan will pay you in the event that you have cancer, heart attack, or stroke. Plan 1 or Plan 2 pays you different benefit levels, but it still covers the same items. Medical imaging on Plan 1 and 2 is $500 per year. For radiation and chemotherapy, this benefit refreshes every 12-month period, and you are reimbursed actual charges up to a $15,000 maximum on Plan 1 or $20,000 maximum on Plan 2. And again, that's an annual benefit. Intensive care is $600 per day on either plan. And then you also have a first occurrence benefit. So if you are diagnosed for the first time with cancer or a heart attack or stroke, you'll be given a $5,000 benefit for you or your spouse on Plan 1 and $10,000 on Plan 2. And your children's benefit is $7,500 on Plan 1 and $15,000 on Plan 2. Both plans offer a diagnostic wellness test reimbursement, and that's $50 either plan per year. Don't forget, guarantee issue does go away after your initial eligibility time frame. The rates for this plan are listed in the benefit guide as well as in the enrollment site. Your employee contributions for additional plans are listed here. They're also in your benefit guide. Your dental will still be with Cigna, vision with Davis Vision. Your flexible spending account limits are listed for you, and then the cost for your accident plan and cancer plan. On the critical illness, those are subject to age and amount purchased, so those will populate when you go through the enrollment process, and then the legal plans. There are individual age banded rate plans for short-term disability, buy-up long-term disability, the buy-up long-term care, supplemental life and accidental death and dismemberment, and critical illness. Personal home and auto rates are quoted individually. Okay, as a reminder, there are a few things for you to do. First of all, review your interactive employee benefits guide that's included in the enrollment. Remember, every employee must log into MyPay to make your elections between November 7th and 18th. You will either elect to continue your current benefit plans, elect your 2017 Community Fund and 401k contributions, change any of your plan elections, change any of your covered dependents, elect your 2017 contributions to the flexible spending accounts for medical and or dependent care, elect your 2017 HSA contributions, and elect any of the new worksite plans. Don't forget, guaranteed coverage is only available during this open enrollment period or at your initial eligibility. If you do not log in and make your elections, you will only receive the default benefits for 2017. That would be basic life and AD&D, long-term disability, and base long-term care. If you have any questions regarding the enrollment process or any of our benefit plans, please contact the Higginbotham helpline at 817-347-7093. Or if you're in the office, it's extension 7093. You can always email helpline@higginbotham.net. If you have questions regarding a bill, again, please call Compass. And if you have any urgent medical care that you need, but it's not an emergency, please remember about that telemedicine benefit. It is there for you at absolutely no cost. Thank you very much for listening, and make sure you get enrolled.